Hello, sir. You recently treated a 2-year-old in a hospital setup. Could that have been avoided?
So with the advent of new materials and the entire pediatric dentistry moving towards being minimally invasive, we have a lot of new materials like the cavity fighting liquid and silver diamine fluoride that usually comes handy provided these parents had knocked early.
So, could you let us know more about it and how it works?
So we usually recommend that these parents establish a dental home with us so that we start seeing these infants and the newborns as early as the eruption of the eruption of the first milk tooth, or say after 12 months. That's the time we should be checking these little ones. And in case we start seeing these first signs of cavitation, which can come in either because these teeth have already been hypoplastic, or they have been inherently weak, or as a result of ad libitum breastfeeding. So the white patch is basically a reversible phenomenon, and if we intervene early with the use of the cavity fighting liquid, these cavities can just be arrested at that stage itself.
So, what medication is used for it? Like,
So we use something called as silver diamine fluoride, or for a layman's term it's called as a cavity fighting liquid. So silver is a very potent antimicrobial, so you must have heard about these ointments that are used on burns. So it has silver as the major component. So silver is a known potent antimicrobial. So what the silver component does is that it kills the bacteria. And the fluoride, as we all know, that its benefit into remineralizing the tooth surfaces, and of course it has its activity against the oral microflora that causes cavities. So all in all, when you compare the silver diamine fluoride with your regular fluoride application, the silver diamine fluoride 2 applications in 1 year eventually leads to arrest of these cavities, provided this happens with a diligent home hygiene protocol.
so is this like a definite solution to all my teeth?
This can become a definitive solution only and only if parents follow the home hygiene instructions that we've given. And if they have established a dental home, then they will fall into the repetitive cycle of regular follow-ups, because we want to see these children every 3 months for the first year. And in case it may so happen that of the 6 teeth that have been treated with the cavity fighting liquid, maybe 1 or 2 is still active. So the moment we catch them early and catch them young, we may have to do, say, multiple applications of silver diamine fluoride for maybe 1 or 2 teeth of the n number of teeth that may have treated in the first visit. But the ideal suggestion is that you do the second application after 6 months. Now this second application is also very crucial because studies have shown that when you compare 2 applications over 1 application, your success rate of arresting these cavities increases by almost 30 to 35%.
In what other cases can the caries fighting liquid be used?
So we've tried our hands on smooth surfaces, that means your front teeth. But you'll be surprised that even the back teeth, which are retentive surfaces, I mean if your child has had a bar of Cadbury or a chocolate, and after 5 minutes when you look into inside the child's mouth, you'll see that the chocolate has been stuck on the surfaces of the back teeth. So there's a simple procedure that is there which is called as a sealant, which covers these grooves, not allowing the chocolate to be stagnant on those surfaces. So if any sugary product is not stagnated on these surfaces, it will bring a break to the progression of the cavities. But sealant is basically a technique sensitive procedure, doc. It involves cleaning the tooth surfaces, preparing the tooth surface with a material called as an etchant. Now that does not taste good. Third is this attention span of children who are 2.5, 3-year-olds. They cannot sit on the chair for these kind of technique sensitive procedures. So we happen to try this medicine as sealants. So we only scrub this medicine on the top surfaces What happens as a fallout is that after a week or two, when we see these children at follow-up, you can see black lines on these surfaces. So this medicine basically interacts only in those areas where there is caries activity. In areas where there is no caries activity, this medicine will not stain any surface black.
Okay. So is there an age barrier to using this medication or?
Oh, there's no age barrier. We use this medicine in special children also who are 16 years of age or 18 years of age. This medicine actually comes handy in cavities which have just begun between the two teeth surfaces. Now these cavities are the most notorious in children because you don't see them unless they actually break down, and by then we are very late and end up doing root canals. So it's only when we see these children early, our eyes are trained into seeing those changes that happen between the two teeth, and introducing this medicine at the right time does wonders for these children.
Are there any disadvantages or unlikable results of application
So
of
if
this
you
medication?
ask me as a clinician, I would say no disadvantage. But as a parent, when they are choosing this for their child, what usually holds these parents back is the black appearance. So what happens is the byproduct of the silver reacting with these bacteria is black in color. So after the application, you will start seeing these teeth as pitch black, dark black. But unless the child is actually asking for a white tooth, I don't think parents should inflict their attitude about looks and appearance into the child. So what we are treating here is basically controlling the progression of the disease. That's more important because what happens is you don't end up putting the medicine, these cavities progress, and we've treated all these children as we started this small talk with discussing that case of a 2-year-old. Now, why did we have to treat that little one in a hospital setup? Because that child landed up with a periapical abscess, that means pus with the front tooth. And there was no way we could handle that little one chair side. So we had to put that little one to sleep in a hospital setup. We ended up removing multiple teeth for that child. So what this medicine is doing is basically preventing the progression of this disease. And of course, when the child's capacity to sit on the chair improves, that's the time we can actually cover these teeth with white crowns without doing any root canals.
So can this medication, the caries fighting liquid, be used in a child who has had pain to avoid root canal treatment?
No. So if the child is already symptomatic, that means the nerve inside is already inflamed. Now what happens is when you put this medicine very close to the nerve, it may cause more damage because this medicine has a property of penetrability. Now when this medicine penetrates and tries to arrest the cavity, the best part is that it also tends to reduce the sensitivity. But if it is applied so close to the nerve, it may cause irreversible damage, and what you have done may actually lead to development of the pus in that tooth. So teeth, after examination, due examination and taking a clinical history, if it's indicated for a root canal, then you might as well follow your doctor's suggestion and then go for it. But in case the doctor feels that yes, this medicine will come handy, then this is the go-to medicine for your little one.
So as you said that color is something what the parents are a bit concerned about. So are there any other alternatives to SDF or any latest technology in which it works but avoids the discoloration?
So as clinicians, we are also eagerly awaiting the launch of nano silver diamine fluoride, which the manufacturers are claiming that it was not going to stain their teeth black. And if that comes into the picture, it's going to change, it's going to revolutionize pediatric dentistry.
Could you just tell us how this procedure is done in the clinic?
So it's pretty simple. There's just a drop of medicine that is used. We have an applicator tip or your brush, which is used to simply just scrub on the tooth surfaces, like how you apply nail polish on your nails. This is like a tooth lacquer, which is just scrub on the tooth surface. It hardly takes 2 to 3 minutes, and then we protect that thin layer of silver diamine fluoride with a final layer of fluoride varnish.
So this is like a definite treatment, especially for the children in the age group of 1 to 5.
Of course, of course. But it's just that if you don't control the other factors at home, so basically understand that cavity is a multifactorial disease. So if you're not taking care about the diet, about the brushing habits, then if I had not applied the medicine and the cavity would have a cavity that would have progressed in say 2 months, the cavity fighting liquid will say delay that process by another 2 months or 6 months. But if you, along with the application, 2 applications in a year, and if you're able to maintain a good follow-up with us and a definite home hygiene protocol, then be rest assured that these cavities will arrest.
Thank you, sir, for your insight in the cavity caries fighting liquid, and hopefully people understand the importance of minimally invasive treatment in their children, especially in the young age groups.
Correct.
Thank you,
Thank you.
sir.
Thank you.